ये सब बात हो गया। Hey guys, नॉर्मली जब हम डेंटिस्ट के बारे में सोचते हैं तो हमें लगता है कि यार हमें दांत दुख रहे तो हमें डॉक्टर के पास जाना चाहिए. आई हैव नेवर बीन टू अ डेंटिस्ट एवर इन माई लाइफ, बट टुडे हियर आई एम विद द चौकठा एंड दिस to check what the teeth are going to look like. Well, I am not a dentist and I am not learning into a dentist. But today we have a guest who is a dentist since last 11 years. So let's welcome Dr. Sonali Jain, who is a dentist, and she has invited me here for a date with her dentist, a date with how I can or how we all can know that what are the myths that are running around the dentist and why we should visit a dentist every 6 months. So let's welcome her and let's interview her. Hey guys, so today we are having a doctor, a dentist. She is Dr. Sonali, a dentist. So today we are going to interview her and know her that why people should prefer dentist and how she can help us. So let's welcome Dr. Sonali. Thank you so much for coming in our show.
Thank you, Disha. Thank you for having me and thank you for hosting me.
So Dr. Sonali, there are so many professions when we think of a doctor. So why have you chosen a specific dentist profile?
Okay, so I'll tell you. Basically, since I was a kid and I have a younger brother who's 4 years younger to me. So as kids, both of us had a lot of dental cavities, a lot of dental issues back then. So this is some roughly 25-30 years back. As kids, we were having a lot of dental issues. And we were going to Bombay Hospital to a doctor to get our cavities filled. And tab se that thing has gotten into me, and I was always fascinated with the dental chair and the dentist. So I think मेरा जो psychological molding होता है ना, it started then. And उसके बाद always whenever my parents used to go to a dentist, I used to accompany them and see what is happening. I used to be so fascinated. तो sure था कि डॉक्टर बनना है और डेंटिस्ट ही बनना है. It was quite sure. I was very sure of that. And that's how I think बचपन से है कि डेंटिस्ट ही बनना था.
So since how many years are you practicing dentist?
I cleared my graduation in 2010. I completed my internship in 2011. So I'm practicing since the last 11 years now.
Oh, so I'm interviewing an 11-year experienced doctor today. Think of a dentist. हम normally यही सोचते हैं कि यार दांत दुख रहा है चलो डॉक्टर के पास जाते हैं. So एक मिथ है कि यार मैं बोलूँ एक कॉमन साइकोलॉजी है कि अगर डेंटिस्ट है तो दांत का दुखना जरूरी है. So are there any other procedure or any other scope in dentist?
Definitely. So there are many other procedures. Usually पहले के ज़माने में ऐसे होता था कि डेंटिस्ट के पास लोग कब जाते जब दांत में दर्द है, मोस्टली तभी ही, अदरवाइज कोई नहीं जाना चाहता. But today with the social media, especially with YouTube, with Instagram, everyone wants to flaunt their smile. Everyone is so aware and so conscious of their selfies कि अच्छा दिखना चाहिए एकदम. So people have become so conscious and so aware these days. So people, I see so many patients for teeth whitening. लोगों को ऐसा लगता है कि उनकी स्माइल उतनी ब्राइट नहीं है और they have maybe yellow colored teeth. So they want to make it better, more whiter. Teeth whitening is a procedure. अगर आपने सुना हो तो jewelry के बारे में, so we add a small diamond on one of the front tooth to give you that extra sparkle on the smile. So that is about the jewelry.
Well, so we can also wear jewelry in our teeth.
Exactly. Yes.
Oh, wow.
Yes, you can.
Well, we should definitely give a try to this thing.
Yes, and then there's other things called cosmetic smile correction, which includes veneers. तो अगर किसी के दांत आगे पीछे हैं या दांतों में gaps हैं, and they're not keen on doing braces or aligners, so there is something called as dental veneers, where the teeth can be straightened inside 7 days. So smile correction या smile makeover हम जिसे बोलते हैं, to get a better smile can be done. So there are many procedures other than पेशेंट पेन के साथ आता है. One basic thing that we talk about is dental cleaning.
Yeah, whenever we think of a doctor, it's because of the pain. If अगर पेन है तो चलो डॉक्टर के पास जाते हैं. So yeah, that's the reason we can also, if you want to wear a jewelry in your teeth, you should visit a dentist.
Yes, for sure.
So, what kind of patients do you usually get?
I am seeing, because I have a family dental care setup, I am seeing patients right from 2 years up to my eldest patient has been 85 years old. We've done dental implants for patient who is 83 years old, Mr. Anthony. So I am seeing patients right from 2 साल से लेके 85 years तक के patients को we are catering to, and different needs, जैसे बच्चों को अगर fluoride करना है या कुछ early cavity fillings है, even for general counseling, even for dental counseling as to how to take care of your teeth, so that आगे चल के वो खराब नहीं हो. Food habits, how they should be, cleaning protocols, how they should be, so we can provide counseling for them. Then comes an age group where लोगों को braces की ज़रूरत है between 10 and 14 years usually, तो उनका dental braces का treatment, aligners का treatment can be done, और dental implants are done over here, root canals are done. So anything you can think of dental can be done. It's like that.
So since you are dealing with such a contrasting age group people, how do you coordinate with them, or how difficult it is for you to handle everyone?
So basically, the entire thing depends on behavior management, because बच्चों की psychology अलग होगी, किसको कितना डर लग रहा है, that will also be different with different people, right? So it's just about, I think, real psychology. If we understand how the patient wants to be treated, it won't be that difficult. So that's how we deal with it. With kids, we talk a little different things, and उनको maybe cartoons के बारे में discuss करके या distract करके. That's how with adults we don't need to talk that much or distract them so much. But still, yes, one more important thing, while we are doing any dental treatment, we make sure that we are playing background music.
Oh, you play background music?
Yes. So it's always like some Bollywood playlist which is happening here. It could be bhangra, it could be instrumental, it could be the older generation, 60s wala, 90s wala जो music था, it could be that. So it helps, like, soothe or calm the patient, and that's how we can give them longer appointments and shorter number of dental visits. That's what we assure कि आपको कम बार आना पड़े, ज़्यादा काम एक बार में हो जाए.
So normally जब patients आते हैं तो when they are in the too much pain, if they are in too much pain or they are scared of the अरे कुछ अंदर जाएगा, हमारे दांत टूट जाएंगे, खींच लेंगे या ऐसा कुछ होगा. So is it difficult for you to handle such people, or it's not always that thing?
So basically, because now I've been working since the last 11 years, it's gotten easy, I would say. Now it's gotten better, but this you can only learn with time. This is not a subject that is taught in a dental school, right? So with experience, with meeting so many people over such a long time, in 11 years, maybe I must have seen more than 50,000 patients. So talking to them, understanding their different psychological needs, and patient को अगर बहुत ज़्यादा pain हो रहा है तो what he is actually going through, because we all know dental pain is one of the worst pains. Third degree pain जिसे बोलते हैं वो dental pain is one of them. ऐसे है. So I understand that it's difficult for them, so I try to talk to them in such a manner where things are more easy, clear, transparent, and at the same time we start their work in such a way कि उनका pain relief हो.
So when you are working on their tooth, do you tell them everything that they are going to go through this pain and they have to do this, everything?
I try to explain to them in such a way कि ज़्यादा dental ज्ञान नहीं. Whatever they can understand, I try to break it down in that manner so that patient को easily समझ में आए as to what we are doing, and they are aware. उनको anxiety नहीं होनी चाहिए कि अब क्या होने वाला है. That kind of anxiety should not be there. So hence I always give them a gist. एक जैसे हम लोग मूवी का ट्रेलर बोलते हैं, वो ट्रेलर हम उनको समझा देते हैं, बाकी मूवी चलती रहती है. It is like that.
Wow, that's wonderful. डॉक्टर, अगर एक डॉक्टर हमारा फ्रेंड बन जाए और हमें बताए कि अच्छा चलो आज हम ऐसे करने वाला है, so that's wonderful.
True, yes.
Generally, I have met many people who are very scared of going to a dentist because of some kind of myths. So, do you want to clear some myths, or are there really any kind of myths in the dentist?
Okay. So if we talk about two very common myths here. First is when I see patients who want to remove their upper teeth, generally they, not all, but I know a few of them will end up asking me कि डॉक्टर दांत निकाला तो अंधे तो नहीं हो जाते? So the answer very clearly is a big no, नहीं हो जाएंगे. Otherwise we see so many denture patients. हम खुद पर्सनली अप क्लोज एंड पर्सनल अपने बिल्डिंग में भी कितने लोगों को जानते रहेंगे जो डेंचर्स पहनते हैं, बत्तीसी हम जिसे बोलते हैं, या चोपटा चोपटा हम जिसे बोलते हैं. अगर वो पेशेंट्स वो पहन रहे हैं दैट मीन्स उनके एक भी दांत नहीं, मतलब सब दांत निकाल रहे हैं. बट वी नो दैट दे कैन सी एवरीथिंग, दे कैन सी यू एंड से हाय टू यू, राइट? सो दैट इज वन वेरी बिग मिथ दैट आई वांट टू बस्ट, कि दांत निकाला तो यू विल नॉट लूज योर आई साइट. ठीक है. The second myth usually floating around is that does teeth whitening cause sensitivity? Okay, so I want to tell everyone and very clear it out that yes, there are different teething if it is done at the right place with the right products and possibly a right doctor also, will not give rise to any discomfort, any sensitivity, or even if there is some sensitivity वो transient होती है, normally 6 to 8 hours last करते हैं and it subsides down and then you are as comfortable as what you walked in with or better than that.
So you just said that teeth whitening करते हैं. So how long does it last?
Usually teeth whitening will give you a result which lasts around 1 to 2 years easily, and also depending on the habits. So if there is somebody who is a tobacco chewer, excessive smoking की habit है, excessive tea and coffee की habit है, will reverse back much earlier as compared to somebody else who follows very good oral hygiene protocols. वैसे है. So subjective to habits, and when we do a session of whitening, it will definitely last you more than a year for sure. So you can flaunt it in many functions. शादी हो, birthday हो, kitty हो, कहाँ पे भी you will be able to flaunt it for a year. A sparkling white smile.
That's great.
Yeah.
You have a very great sparkling smile.
Without the whitening.
That's nice. So, what would be the your weirdest patient, or I would say any weirdest encounter you had with your patient?
To be honest, there are many, but I'll quickly tell you one very weird experience that we had, which was obviously half of our life goes in saying मुँह खोलो आ करो, because it's a natural reaction कि patient का मुँह अपने आप बंद होते जाता है while we are working. ऐसे है. So there was this patient whom we were working with, there was music on and patient भी इतने ज़्यादा calm down and इतने relax हो गए थे and it was a long procedure. The patient went off to sleep. Patient सो गए and उन्होंने मुंह जोर से बंद किया because he was unable to hear us or control the muscles and जोर से मेरा finger bite किया हुआ है, which is again it was a good thing that patient was so calm that he literally went off to sleep. But on the other side मेरे उंगली में जो काटा है patient ने, I ended up with a big ulcer and it took a few days to heal. Yeah, so that was like a very weird, yeah, and a little troublesome experience also. So yeah.
So it's very difficult for a dentist to treat people at the same time, considering their own hygiene.
Yes.
जब हम डेंटल के बारे में सोचते हैं, हम अपने दांत को सेफ रखना या हाइजीन रखने के बारे में सोचते हैं, what would be the common reason कि हमारे दांतों में कुछ ना कुछ problems आ जाती है?
So usually, see when we as doctors advise anything, we always tell you कि आप 2 बार brush करिए, but and 1 बार floss करिए. So as far as I've seen my patients and in general also, what I feel here in India, flossing awareness is very low. People don't usually know flossing क्या है. जिनको पता है उनको usually ये पता नहीं होता कि कैसे करते हैं. And जिनको पता है कैसे करते हैं वो अगर उनको बहुत if they are lazy, they will end up just skipping it. ऐसे है. So flossing, because flossing is not done, हमारे दांतों में हमेशा कहाँ पे खाना चिपका हुआ ही रहता है. In the interdental areas where brush cannot reach, these areas where it's unable for the bristles to reach. That is where flossing will help. So this is one very big very important thing that everyone should be following is brush twice, floss once, rinse after every meal. हर बार कभी भी खाना खाया है तो if it is possible कुल्ला करने के लिए that should be done. If not, then water should be swished across the mouth and it should be gulped down. वैसे so that will help to keep the mouth clean and for the food to not stick around on the teeth surface. That and उसके अलावा tongue cleaning, tongue and cheek and soft tissues clean either with a tongue cleaner or the end of the bristles. जो bristles हैं उसके end से भी tongue clean कर सकते हैं. Most important instruction.
So normally when we brush our teeth, sometimes बहुत जोर से हो जाता है तो कभी यहाँ दुखता है कभी यहाँ दुखता है कुछ ना कुछ होता है.
Yes. So उसके लिए the most important thing is toothbrush and bristle selection. Always end up selecting a soft bristle toothbrush. Unless the doctor has advised you something else, like after surgeries we'll tell you an ultra soft toothbrush is needed or something like that. But always end up selecting a soft bristle toothbrush. And एक brushing technique का कुछ होता है which I want to stress on, which is usually हम लोग ऐसे normally just like half-heartedly या in like half asleep state हम लोग just घिस के brush कर लेते हैं, which is completely an incorrect method of brushing. So ideally you should be holding your brush and your bristles in such a manner that आप ऊपर नीचे brush कर रहे हो on your front teeth and पीछे circles में. Also make sure and with gentle wrist motion. ऐसे घिस के नहीं brush करना. It's your teeth, you want to protect them. And also make sure that अंदर का surfaces, the inner surfaces is brushed and cleaned really well. Even this inner surfaces. These are usually the most neglected areas in our brushing. So make sure that you brush ऊपर नीचे पीछे circles में. For kids you can always tell them that make bigger circles in the air and then similarly make smaller circles around your teeth, and that's how they will also learn this circular brushing method. And so so this is an important brushing tip, brushing technique and selection of bristles. Make sure that this is soft bristled toothbrush and always discard it once in 3 months.
So when you are describing this brush, I have seen that people are now using electric brush.
Yes.
So are they helpful or are they the myth one?
No, so to a huge extent it is helpful, especially for people who are lazy. उनके लिए तो सोने पे सुहागा. Because if you are lazy, then powered brush is taking up all the onus on itself and doing all the work for you. पीछे circular motions हो रहे हैं, proper forces आ रहे हैं उससे. So again, powered brush or an electric toothbrush is quite a boon. But if you yourself are being able to follow all the protocols properly, then उतना ही अच्छा cleaning can be achieved with a manual toothbrush also.
So अगर कभी हम इलेक्ट्रिक ब्रश से ब्रशिंग कर रहे हैं कुछ करंट लगेगा या ऐसा कुछ है?
No, definitely बहुत low voltage current उसमें से pass होता है and I don't think so.
Because generally electricity and water जब साथ में आते हैं तो we are
it's battery operated ना, it's battery operated.
That's okay.
Yeah, just like your hair dryer. वैसे because even on your wet hair you using something which is dry, तो पानी उसमें जाने का भी possibility है, but it's something like that, battery operated and using very low electric current to run around.
Is it safe for kids also?
100%. Yes, there are battery operated toothbrushes for kids, which are smaller in size, smaller head and everything. So definitely it's safe and it will be more interesting for them to use it.
They don't have to do anything.
They don't have to do it. They'll be more excited. They will use it like a toy. उनको लगेगा खेलने की चीज है. At the same time उनका brushing भी अच्छे से होगा. So
They
again,
are also maintaining their hygiene.
yes, it's a great thing for kids. I would say. Wow.
That's wonderful. So how important it is to have a dentist in a family?
In a family, though I wouldn't say, but for every family there has to be a dentist. Like you should have your family dentist whom you usually go to for your routine checkup and everything. And if there is anything which is beginning, like a small cavity or something, the dentist will spot it and they will bring it to your notice, so that तुम जल्दी treatment या in the right time you can get yourself treated. Instead उसको progress करके बड़ा DK बनाने से अच्छा, या going to root canals, going to implants, उसके पहले ही if you know that this is the problem and this is the solution, you can take care of it. And that is why you should always have a family dentist where your entire family is visiting just for a routine checkup, maybe once in 6 to 8 months. And if there is anything, the dentist will tell you. If there is nothing, the doctor will always tell you कि बहुत अच्छे दांत हैं, nothing needs to be done.
Same. Yeah. There are n number of people who are going through dental problems or the dental implant thing. That everyone wants to do some or the other kind of implants into their teeth.
Okay.
But outside India, there are much more people who are more interested in the hygiene, in their teeth, in their whitening, cleaning, implants, and everything.
Correct.
So, do people come to you for that also, or you have only Indians as your client?
No, definitely. I see so many NRI patients. I have been seeing NRI patients since many years now. But because we understand one thing, that dental treatment outside of India is extremely expensive. And when I say expensive, it roughly means around 10 times more. 10x. अगर कोई चीज का प्राइसिंग यहाँ पे x है तो वहाँ पे roughly 10x रहेगा. So it is extremely expensive. Second thing is getting an appointment for an implant treatment is a very time-consuming procedure. Patients usually end up waiting 3 months, 4 months before they actually get appointed for an implant treatment.
Is it true?
Yes, that is also there. That's also there. So patients usually prefer to come back to India and get all their dental treatment done, which includes dental implants, multiple root canals, smile corrections, smile makeover, whitening के लिए तक patients are coming back here getting their dental, because everyone knows that in India, especially here in Bombay and around us, like if your dentist is investing a lot in the technology and everything, the treatment outcome or the treatment result will be at par. The quality of treatment has become so good even in India with so many good materials available at our disposal, our experience, all the digital x-rays and digital workflow, that the quality of dentistry is now at par. वैसे हो गया है, तो people prefer to come here, get their dental treatment, dental implants done at fraction of cost, maybe 1/5, 1/6, 1/10 of the cost that they would end up paying over there, and they are very happy to get their dental treatments done.
So, how many clients do you have from, or would say outside India?
Literally many. You can see on my feedback post also. There are so many patients saying I've come from Dubai, I've come from London, I've come from US. So I see many patients who are specifically coming here for their dental treatment, enjoying here back in Bombay with their families, finishing their dental treatments in, let's say, 1 or 2 weeks and going back to their country.
So, have you thought of going abroad and study further for this field?
Why not? I mean, I am open to learning all the time, and definitely maybe when the time comes, I am always upgrading myself. Right now also I have done my fellowship in skin and hair cosmetology, like I was mentioning to you before our interview. So I am always open to learning and upgrading, and as and when I think I will get a chance, I will go for sure. But coming back and practicing over here, giving the best to all my patients out here as well.
That's wonderful that we are having a learning doctor, always upgrading doctor.
100%. I think learning is never ending. कभी खत्म नहीं.
So, last but not the least, what are the secrets that a dentist would never give to their clients or their patients, but would you like to share some secrets to have a healthy dental life?
Okay, so usually when I talk to my patients or when I talk to my friends, they tell me that they are brushing thrice, but I don't see that. I see their teeth are still yellow. They still have a lot of tartar. So when I discuss it more, I understand that usually my patients are brushing right after their meals. I see so many people who brush right after breakfast, right after their lunch, which is the most unhealthy way you could deal with your teeth. So basically, right after eating or having any meals, your teeth are more susceptible to losing out the enamel, and hence after your meals you will just swish water here and there, maybe gargle a couple of times, and that's the best way to go. Never ever brush right after the meals.
Please wait for an half an hour.
Brush before your breakfast and after dinner, an hour after dinner. So yes, wait for an hour at least. Brush after that and then go off to sleep, like that. But don't rinse or don't brush right after eating. That will lead to more sensitivity. It will lead to more enamel loss. So I think that is one very important tip that should be kept in mind.
Wow, that's wonderful. I don't think any doctor would share such beautiful tip, and thank you so much, Dr. Sonali, for giving us so much knowledge and how we can protect ourselves and have a very beautiful smile all the time.
Thank you, Disha.
Thank you so much. Thank you guys. Thank you.